Hello there, from wherever you are watching us. This is Golden Minute Show. I am your host, Ann B. Today, I'm privileged to be joined by Dr. Esther Ndidi, who is internationally known as Dr. Fitness. Just before we go to the field, let's know who is Dr. Ndidi, because she's had her 3 golden minutes. She became Mama Joshua, Mama Darlene, and Mama Caleb. Now, join me. Hi Esther. How are you?
I'm good.
Dr. Fitness.
Yes, I am.
Tell me about yourself. Who are you?
I am Dr. Esther Dindi. I am a medical doctor. I like bragging that I have 2 degrees in medicine, MPCHB from the Moi University School of Medicine, and a master's in internal medicine from the University of Nairobi.
That's great.
So I am a consultant physician. And beyond that, because I love fitness, I have a passion for working out. I actually trained with International Sports Science Association. I am a certified fitness trainer. But beyond that, I just love being a wife and a mother of 3, as you've already alluded to. Yes.
Mother of 3?
Yes.
But you look so young.
Oh, thank you. Oh,
Courtesy of fitness.
Yes, it does help. It does help.
Like this. Okay, now let's talk about your children. You started by being pregnant.
Yes, I did.
Twins. Did you ever think that you could get twins? Was it your prayer or it was just luck?
Now, this might sound cliche, but it's the truth. It was an answered prayer.
You wanted twins?
Yes, I wanted twins.
Pray, you'll get twins.
Yes, as the Lord wills. I know we don't always get what we want. So for me, I actually say God favored me, that he answered my prayer in that way.
Amen.
Yeah, but I decided to have twins, a boy and a girl.
Wow,
and
that was
actually
nice.
got twins, a boy and a girl. I thank God.
Tell me about pregnancy.
Pregnancy.
No,
wow.
we let's talk about this pregnancy, twins.
Yes.
According to to my knowledge, twin pregnancy, the minor illnesses may be more exaggerated. Now, for you, how was it?
Let me say, okay, one, I was excited. My hubby and I were excited when we discovered that we were pregnant, because we had planned for it, yes. But when it happens, it's always an exciting moment.
Sure.
And of course, the first 3 weeks were okay. I hardly noticed I was pregnant, that nothing had changed really. But way into the 2nd month, and I tell you, like everything was nauseating.
To start with, you missed what women miss.
Oh yeah, the menses.
Now you are a
disappeared.
doctor. You did a test, self-tested, pregnancy positive.
Yes.
But you didn't know it was pregnancy positive times 2.
Yes, I didn't know. Of course, it doesn't warn you. It turned positive very early, actually before the 1st month, maybe into week 3. And yes, and so the symptoms just came in to confirm. But I wasn't sure, I mean, when you pray, God might choose to answer you or not.
Because he's God.
He is God. He is supreme. He's supreme. So it took us a while to actually confirm that they were twins. Although I was convinced that they were twins. So every time I tell my hubby, he prays for one baby, and I'm not saying amen until you pray for the 2nd one.
That was good. You're a woman of faith.
Yes.
I should make you a better friend.
We already are friends. I feel like I've known you forever.
Yes. Now tell me, at what point did you discover that you are expecting twins?
Precisely, it was in the 5th month. I think we were actually 21 weeks pregnant, and so that time I was working in Nyeri PGH then, and so we decided to go for an ultrasound. And yes, I remember when Daktari, the radiologist, just placed the ultrasound probe on my lower belly, and there we just saw 2 heads, and my husband was there with me, and all I can remember were tears flowing. I was like, oh, God. I was, tears of joy. I was like, oh, it's twins. It's twins. Yes, it was exciting. That's when we discovered they were twins.
That is very good. Now tell me, along the journey, was there anything that was far beyond your expectation? Like, we have women vomiting, we have women complaining of backache, we have women hyperemesis. Did you ever suffer any?
I did suffer hyperemesis, because of course that means
hyperemesis Hyperemesis is when a woman can't retain anything. She vomits almost everything. She takes food, she vomits. She takes water, she vomits. And that one is very common in twin pregnancy. Now, did you have that?
Thank God I didn't have that.
Wow.
Yeah, I vomited once in a while. I was nauseated most of the time, but nothing in the
Exaggerated.
extremes. So I never had to be admitted to be given IV fluids, like would be the case in hyperemesis.
Sure.
And yes, so I was still able to retain most of whatever I took in.
That was good.
Yeah, but the nausea was there. I remember I changed toothpaste from Colgate to Aquafresh to White Dent. I tried it was nauseating. So brushing was really a stressing time. But I know not everyone has to go through that. But that was my journey, and yes, I came out successful.
And pika is where women tend to eat anything, including soil.
Oh, and ice cubes.
And ice cubes. I ate ice cubes. I really did. I did. For sure I did.
That's
yes.
more common actually in the Caucasians.
Yes, no?
Yeah.
Did you suffer any?
No, I actually didn't suffer any of that. I know at some point, actually by 5 months, and forgive me as a doctor still, I know I misbehaved. I wasn't on supplements. I didn't check my HB in good time. So I discovered at about 4 months my HB had come to as low as about 10. You know, it's not good to have it fall at that level.
And especially when you're expecting twins.
Yes, so I was actually put on iron supplements.
That's very good.
Yes.
Let's stop for a break. Kindly don't switch off. We are coming back. We really want to know, how did she deliver the twins? Be with us. Thank you very much for joining us once again. Mostly in twin pregnancy, the babies tend to come earlier because of the pressure in the uterus.
Yes.
Now, you were there carrying twins. Did yours come earlier or they went up to term?
Actually, I carried my pregnancy all the way to term at 39 plus, I think about 5 days.
Wow.
And it's because I did not have any symptoms that indicated any earlier delivery, and probably my height did contribute, so I had enough room for growth.
Sure.
Yes. So that, in discussion with my gynecologist, we were able to safely carry the pregnancy all through to term, and so I was delivered at term. I did not go into labor though.
Why? You feared?
Okay, not really. Partly, let me not say, I'm strong, I didn't fear.
Wow.
But really what happened is that I was carrying twins, a primigravida, that is a first-time mother, and the first twin was transverse. Rather, no, the second twin was transverse.
Okay.
And so being a medic, having gone through the processes of sometimes seeing the first baby delivered and the other one being delivered through cesarean, trained, that does happen. I think I had that understanding.
Yes.
So we discussed it and settled for an elective cesarean section.
And that is why we keep on advising women to honor their TCAs, return to
it's very important.
The return to clinic dates.
Yes.
Because this is when we have the midwife, the medical personnel palpate the abdomen, and they get to know even a single baby, a single fetus can malpresent.
Oh yes.
It can even lie transverse.
That happens a lot.
It happens a lot.
It does.
And that is why we advise women out there, don't wait until the last day. And especially those women who are giving birth for the second, third time.
Oh, they tend to be presumptuous.
They think they know everything. Please, you don't know everything. Come to us, honor your midwife, honor your doctor, adhere to your to clinic date, TCA.
And do the ultrasounds when they are asked for. It's very important.
And still, actually, we're going to talk about ultrasound someday, not today. Women really fear ultrasound. They think it does harm to the kid.
It doesn't. There's no radiation to the baby. I think
we'll talk about it someday.
Yes.
No, you chose to be operated.
Yes.
Ulichagua kuchinjwa.
Yes, I did. Yeah. Let me say, kudhijwa. Okay, in a way, I was a first-time mother, a primigravida. I was carrying twins. And beyond that, one of the twins was transverse. And as a medic, I've seen people have delivered naturally, and then the second baby is trapped, and they end up with a cesarean section. So in discussion with my gynecologist, we deemed it more appropriate just to go for a cesarean section, one touch. Yeah, so I was psychologically prepared for it, because that decision was made way before the delivery. So yeah, it was okay, it went fine.
With the privilege to choose the birth date.
Oh, and by the way, I must highlight on that, my twins were born on my birthday. So, you know, as you...
No, that's being selfish.
It wasn't, you know.
Okay.
It's when the...
Okay.
Things shine on you anyway. It's we were actually to have the babies delivered on the subsequent day, and as we were discussing, I said, oh, that's going to be the day after my birthday. So my gynecologist, I don't know whether I should mention his name, who is an awesome guy, Dr. Juguna, actually at that point said, no, we can actually bring it forward to your birthday. And yeah, thanks to my gynecologist, Dr. Juguna, I ended up delivering on my birthday.
Now, were there complications after the twin delivery?
There weren't. Of course, complications in terms of medical, I did not have complications. I didn't have excessive bleeding. One, it was under, it's the bikini line, that's the lower incision, and the other thing that it was under local anesthesia. My husband is a doctor, so he was allowed into theater.
Wow, that was
and I was able to
It's very comforting.
Yes, it was, and I was able to hear my babies first cry, to kiss them, because I was fully awake. It's good for people to know that there are options. You can be under general anesthesia, whereby you're fully asleep, or it can be local, whereby you're sort of paralyzed, quote unquote, on the lower segment, and you can be chatting with the people in theater. That was my experience. So I didn't miss out on kissing my babies and hearing them cry.
That was very good. Now, there's a woman who is watching us, and she's carrying twins. One word for that woman.
For anyone carrying twins out there, get encouraged. Get encouraged. I've been through that journey. You can carry those babies to term, all going well, and I wish you all the best. And the other thing is that be in touch with your midwife, be in touch with your doctor. It's very important to be able to discuss even the modes of delivery depending on your circumstances, and just be in optimum health to be able to bring forth healthy babies. I wish you all the best. I've been there, done that, walked that journey, and I understand your challenges.
And I top up. Kindly don't assume anything. Are your legs swelling? Are your eyes swelling? Is your BP checked? Is it within control? Have you checked your HB? Are the lab requests
very important
done?
Yeah.
Kindly don't assume. Dr. Fitness got her third born. No, actually it's third born. It's twins.
Yeah, it's a third born.
One, two,
it's a third born.
third born.
Yes, it is.
Kindly don't be gone. We will be back with Dr. Fitness.
Yeah.
Thank you very much for being with us. Should I tell you a secret? After this, with Dr. Fitness, we are going to do some exercises with 3 beautiful pregnant ladies. Yay! It's a secret, don't tell everyone. Now, Esther.
Yes.
On 21st February 2015.
Yes.
Golden minute. You've got another baby boy.
Yes.
Now tell us about
some
baby
bundle
boy.
of energy and joy as well.
Tell us about him.
Yeah, that born is called Caleb.
This time you didn't pray for twins? Okay.
Sasa, you know, once the prayer was answered, that was adequate. So the second one, I think now also being older, I didn't think I had the energy for it. Anyway, that aside, we just decided to have an extra baby. And yes, so on that date, Caleb was born.
Sure.
Yes, and he was born by a cesarean section as well.
Now, in medicine, there's something we call trial of scar.
Yes.
Where a woman has delivered once.
Yes.
And we give this woman now who is pregnant for the second time, one operation, a chance to deliver normally.
Yes.
Why did you choose to go for CS again?
Okay, one, I am a firm believer that cesarean section and natural delivery are both normal, so long as it leaves the mother and the baby healthy.
Sure, that's very correct.
Yes. And so I weighed my options, and I totally salute all the women that choose to deliver
once
naturally.
again.
I do. Peace, you know. Yes, but I just thought I'd walked through the journey of cesarean section before. I could walk it again. I was given the options again. We discussed with my gynecologist. I was given the options of trying the scar. but I felt I'm comfortable with the cesarean section, so I went for that. But it's good for one to know that there's actually the option of trying your scar.
Yeah, there's an option.
Yes, there is.
Now the baby came.
Yes.
Was there any problem along the journey? It being the second pregnancy.
Being a second pregnancy, I know for most people, the second pregnancy or the third or the fourth tends to, you know, going through the journey is easier. Shopping for maternity wear, sometimes you have some from the previous pregnancy, which happened to me. Yes, but well, the journey was easier. I was not as nauseated as the first time, and I carried it with a lot of grace. I was very active and all that. Post-delivery, I took a little bit longer to recover as compared to the first time. The first time I bounced back faster. The second time I got some slight inflammation around the incision, a bit of cellulitis, so I was put on a course of antibiotics.
Wow.
And so I took a little bit longer relatively by about 1 or 2 extra weeks. So every delivery, I think for every mother, regardless of how many children you have, it's always unique.
Can I ask you a question I was asked by one woman?
Please do.
Do doctors feel pain?
Okay, sorry. We are all human beings. The same blood that flows in your veins.
But you know
flows
the
in
drugs.
mine. You know the drugs, but the body has the same nerves, and
Yes.
so we feel pain just like any other person. We are prone to illnesses like any other person. So yes, to answer that person, doctors feel pain. Actually, they might experience perceived pain more than others. It's
Actually, what I
psychological.
usually tell people, mostly, other than being exposed to the drugs, it so happens when your kid gets sick,
You're more anxious.
your mind goes blank. You don't
It's
even
true.
remember that one drug.
If I
that
have an issue, I have to
even
call
for
my
pain,
doctor. I
you
call
have
my
to
doctor.
call. It has
Yes.
happened to most of my friends. It has happened to me
Yes.
that my kid coughs.
Get
Hello,
worried.
mtoto
Oh, the
anakohoa.
fever is high.
Yes, the fever is high, and it's us.
Normal.
It's
and
normal.
being a mother,
Yes,
really,
it's being a mother.
You're concerned about your baby. You're worried. The problem is that medics actually worry more than
It is very true.
the lay people, because you're like, could it be that? You think of bigger diagnoses that are not the case.
It is very
sometimes.
true.
Yes.
It's very true.
Yes.
So your baby comes
Yes.
via cesarean section once again.
Yes.
The inflammation.
Yes.
Many women have suffered the same. Now, how long did it take before it healed?
It took about 1.5 weeks. Yes, I think because one challenging thing which I think even predisposed me, and I would caution any mother who's recently given birth to a baby, you will have visitors coming into your house. That's true. But the longer you sit, especially if you're a cesarean section mother, you tend to get fluid
Yes.
sitting around the incision, so you get edema, and that in itself is an easy culture for infection when you're still recovering.
Now, hold there.
Yes, yes.
Can you look at that camera? No, not as a fitness doctor, but as a medical doctor who has gone through 2 cesarean operations.
Yes.
Can you tell that woman who has been scheduled for a cesarean section,
Yes.
who has just gone through it, kindly tell her something?
Hi, I'm looking at you. You've just had a cesarean section. I know you're feeling that pain, and you need to be on the medication that you are given. Of course, you'll have painkillers, that's the analgesics, as well as some medication antibiotics to prevent you from getting an infection. Please follow them as per prescription. If you have any issue of concern, contact your doctor or go back to the hospital and get checked. And please take some rest. You'll be visited by many people who are excited as your new, bundle of joy. But you need to take time to rest. You need to also walk and ensure that you're well hydrated. Just take care of yourself and take care of your baby. Your health matters to you and to the baby and those around you. Yes.
What about when she breastfeeds and this pain on the scar?
That will happen sometimes because as you breastfeed, there's a hormone we call oxytocin that is actually released, and that helps, of course, bring down the milk as well as helping in contracting the uterus. So that pain you feel is actually things shrinking back to normal. Don't be worried. That is going to ease with time, and you're going to just go back to a rhythm that is manageable.
Actually, frequent breastfeeding is the management for that pain.
It is.
The more you breastfeed,
and the more milk you have as well.
Yes, the more milk, and the faster the uterus involutes, goes back to normal, and then the pain disappears.
Yes.
So thank you very much for being together with us from the time we started with Dr. Esther Ndindi, our fitness doctor. Kindly don't miss us next as we do our exercises.
Yes.
This is your best show, Golden Minutes Show. And once again, I am your host, Anne B. Till we meet again, bye.